Hi, I'm Dr. Kavita. Please do watch, share, subscribe to my channel. In this part of the short, I'm discussing about nasal polyps. Coming to diagnosis is made by physical examination inside the nose, sometimes supported by imaging like CT scan to assess size and location of the polyps. Coming to treatment, medications like steroid nasal sprays or drops to shrink polyps can be used. Short courses of oral steroids, if needed, are necessary. Surgery. If medication fails after about 12 weeks, surgery may be performed to remove the polyps. However, polyps often recur, so ongoing steroid nasal spray use may be necessary post surgery. Antihistaminics may help symptoms but don't treat the polyps themselves. Antibiotics are only used if infection occurs. Next, complications. There may be blockade of the nasal passages and sinuses. There may be recurrent sinus infections. There may be worsening asthma symptoms. Rarely, nasal bone changes or broadening of the nose with long-term untreated polyps may be present. In summary, nasal polyps are benign inflammatory growths in the nose caused by chronic inflammation and associated conditions. They cause nasal blockade and other symptoms and are treated primarily with steroids or surgery if needed. Medical students, what do you read about? What are nasal polyps? What are the symptoms of nasal polyps? What are the symptoms that are caused by nasal polyps? What are the causes of nasal polyps? What are the risk factors involved in formation of nasal polyps? How do we diagnose nasal polyp? What is the treatment basis in nasal polyps? What are the complications in nasal polyps? How can we tell if our nasal polyps are growing or worsening? Why do some people develop nasal polyps while others don't despite inflammation? All these. Thank you.